Hello, good evening.
Good evening, Grandpa.
Right.
Good evening, Grandpa.
Yeah, hope you're all doing well. Good. And we're going to continue where we left off. Today, it appears the network can be a challenge. I've already had some few hiccups, and I hope that it doesn't continue. All right. Is there any question, any problem anybody wants to share with us or to ask before we move on to today's session?
Please, Grandpa.
Yes, sir. Yes, sir. Go on.
Please, the last two lectures about the Semen volume. I realized that according to WHO, it was said 1.5 to 6, but when later it was said that under another one, it mentioned that if it is greater than 5, it is hyperspermia. But the volume, they said 1.5 to 6. Why not when it's above the 6, the 5?
Come again. I can.
No.
I said come again.
The Semen volume.
Yeah.
It was said from 1.5 to 6.
Yeah.
But it is also said if it is greater than 5, then it is hyperspermia.
Okay.
So
I'm saying that some references make it 1.5 to 5. Some even make it 1.5 to 5.5. But the WHO current edition makes it 6. Makes it 6.
Okay.
All right.
Okay.
And in some books, they will even just write greater than 1.5. If you say greater than 1.5, it means that there's no upper limit. Okay. It's like, especially the pH. Some people will just quote, not that some people, some literature will quote greater or equal to 7.2. When you say greater or equal to 7.2, then it means that even 9 is normal. Okay, but unfortunately, those are some of the challenges we have with semen analysis. Remember, before we even went on to the semen analysis, I tried to take you through the limitations of semen analysis. Okay, the kind of variability that goes on, even with the WHO itself. As we move along, especially when you go to the morphology side, just the last edition, they quoted normal morphology to be 14%. Now, morphology has come to 4%. You understand? Even from the whole same WHO. So it creates a whole lot of problem with the kind of variabilities that are encountered with semen analysis. And those are some of the things that you must know. And as we move along, you see that a lot of the parameters are just by way of subjective processes. When I say subjective, is the way you see it. When it comes to even movement, the way you see it, the way I see it may be different from the way you see it. If it comes to motility, the way they move, how to assess, the way you see it will be different from the way I will see it, even though we are all looking at. But when you look at, when you are checking for HB, I mean, the procedure is specific, whether the person is doing it in US or the person is doing it in my village. The same analysis, the same procedure and everything, and the reference range is still the same. And therefore, it gives a result which is very, very objective. But when you leave it to me, if you look at the history of HB determination, they used to use a strip, like though we are as if you are talking about the urine dipstick. And that was called a Takis. But the Takis method is based on color. So we dip it in the blood, and then it's as if you're doing the urine dipstick, and then you compare with the color. So the color, somebody will be colorblind. The way you see the color is how you use it to determine somebody's HB, and you can see that there's a lot of variability because it is based on subjectivity. When I say subjectivity, that depends on who is looking at it. All right, so those are some of the inherent challenges when it comes to semen analysis. All right, good. So we continue from where you left off the other day. We were talking about the sperm vitality. We say vitality is the same thing as viability. We're talking about situations where a sperm could be deemed to be immotile. Immotile by definition means that it is not moving at all. All right. So once it's not moving at all, it is as if it is dead. But you may have to go further to do another test to see whether it is actually dead or not. All right. It could be alive, except that it's not moving. All right. And so we said that once your motility is below 40%, and for that matter, once your immotility is more than 60%, you ought to do the vitality test. All right. Other than that, if your motility is normal, in most cases, if it's more than 50%, 60%, 70% motility, you don't need the vitality test. I think I emphasized that. All right. And we said that the simplest test was to do the eosine, and we checked on the eosine, and we used the eosine Y, and we went through the preparation of the eosine. And we said that eosine is a supravital stain. It has the capacity to stain even living cells, and that is one of the nature or characteristics of eosine staining. And we said that when it comes to vitality, we are using, with respect to the eosine, it is based on two principles. One is the dye exclusion, and one is the membrane integrity. All right, and we said that the membrane integrity and the dye exclusion, they work hand in hand. But when it comes to principle, it appears that they are using two principles. But as you try to explain, you see that they are about one and the same. We are saying that once a cell is living or is not dead, its cell membrane is intact. And cell membranes are supposed to protect the intracytoplasmic organelles and then the intracytoplasmic constituents, whatever is within the cytoplasm, the cell membrane or plasma lemma. And for that matter, when it comes to the sperm, the outline is also the cell membrane. Okay, and therefore, once the sperm is alive, then the cell membrane should be working. And the cell membrane is supposed to protect the cell to the extent that it will have to, and Rhoda rightly said, it's semi-permeable. One is semi-permeable. It means that it can do selective sort of things, so that it can allow certain things to go in, and it can also disallow certain things not to go in. And one of the things that it will not allow to go in is macromolecules, and including certain stains. So once even though UOC is supravital, but once the cell is alive, it has the duty to prevent the entry of things like a dye, which includes the eosine. So eosine wants to, and you know that before any dye can impart its color, and for that matter, stain, it must penetrate into the cell. All right. So if you want eosine to stain the sperm cell, then it must have that kind of opportunity to enter into the cell through the cell membrane and stain. All right. But because the cell membrane is intact, and for that matter, the cell is alive, it will not allow it. It will not allow that. And for that matter, it means that at the end of the day, the head, and for that matter, the sperm cell will remain unstained. I think I took my time to explain that. So when it comes to the vitality stain, a live cell or a cell which is not dead will not stain, and therefore it will remain white or it will remain unstained. All right, I think we explained. And then we said that that is the dye exclusion. It means that the cell is excluding the entry of the dye, and that's the dye exclusion. And then you see that it's able to exclude because its cell membrane is intact and it is protecting itself, and therefore its integrity is intact. If the cell is dead, then its integrity will be compromised. The cell membrane integrity will be compromised. Okay, so you see that it is because the cell membrane has its integrity intact. That is why it is able to exclude the entry of the stain. So you see that those two principles work hand in hand. They should be able to, depends on probably if you have to answer a certain question somewhere along the line. Of course, in this course, all our exams are MCQs. But if you happen to also be exposed to a situation where you may have to answer certain questions through a narration, then you should be able to explain from both angles. Either the membrane integrity or the dye exclusion is the same thing. Dye exclusion because the dye which is supposed to enter for it to impact its color is being prevented from entering. And that's the dye exclusion. All right, good. And so that was a very simple test. That's the UOC. Now going forward, the same sperm vitality test can be done using a combination of eosin and nigrosin. Eosin and nigrosin. You see that when we use the ordinary eosin, you just how do you call it? Just one stain, and in microscopy, you can see things better if there's a contrast. For example, if you're doing a gram stain and you have your primary stain, which is a crystal violet, and therefore you have a color, a violet color, and then you should also have a counter stain, which is, let's say, red. So you, and that's either neutral red or saffron. I'm sure you know that when you are talking about the gram staining, your counter stain is either neutral red or saffron. At some point, you can use dilute carbofuchsin, because dilute carbofuchsin also, if you dilute it further, it will give you the same color as though it is neutral red or saffron. All right. So you see that you are going to compare a violet and red. And you see that once you have a violet and red, it gives a contrast. I mean, there's no way you can confuse a violet and red. And so they become very distinct. When you use eosin alone, there is no contrast. The only contrast is that if it is, what do you call it? If it is unstained, and for that matter, alive, the cell is alive, then that you have the sperm cell unstained and therefore white against a red background or something like that. But you see that technically there's no counter stain when you're using the eosin alone. So to improve the contrast, they now added a nigrosin. Who can tell me, those of you in macrobiology, how nigrosin is used in macrobiology? Nigrosin, its application in macrobiology, who can tell me? I'm sure those of you in macrobiology, you should be able to tell me something about nigrosin, its application in macrobiology. Have anybody also heard about the Indian ink stain in macrobiology? Hello? Anybody with idea about Indian ink staining in macrobiology? How many of you on this platform do microbiology at all in your facility? Hey, no response. You see, this program has kept long just because I try to be a teacher, not just an ordinary facilitator, so that I try to teach as much as possible, so that I'm not going strictly by the slide or by what we have to learn. I try to also bring in, if we have situations where we digress to hematology area, we digress to, and because I'm inclined, or my specialty is microbiology, where there is a microbiology component, I try to also do same as much as possible. And that's how come sometimes we have taken all this life, but it's all for your interest, because me, I think that I'm not just interested in the money I get or for whatever, because as a consultant, I'm supposed to be paid per time. But even though this is supposed to be 8 weeks program, yes, 8 weeks. I'm sure we have gone stretch ourselves to 12 weeks and thereabout. You see, but my interest is to ensure that you learn, and you learn good, and you understand as much as possible what you are supposed to know. All right. So if things that I expect that you should know and you don't know, sometimes I get worried. I get very, very worried. All right. And I always say that we should be able to do more to give an indication that we are scientists. All right. To extent that there are certain things like I'm talking about now, the Indian nicks. If a technician doesn't know, fine. But a scientist not to know about Indian nicks staining in microbiology, I think it becomes problematic. All right. So
Grandpa,
I just want, yes, sir, Ima.
with the Indian ink and nicotine, I remember these are things we did in school by I think Mr. Safo Kantanka took us through. I know these are used for
The South
negative
African
staining.
tanker is more of a parasitologist. I know
Parasitology.
him very well. He's a
Yeah,
parasitologist
so
and not a microbiologist, even though
yes,
parasitology is an aspect of microbiology. What I'm talking about
yeah,
is clinical, let me put it, clinical bacteriology, and not even just
bacteriology.
microbiology. All right.
Yeah,
So,
so I remember
okay,
they are used for staining the capsulated fungus
no.
or
That
not
is
that ones.
far off now. You see, in
Okay.
microbiology, you may come across a situation where there could be a CSF will come to you for cryptococcal meningitis. And cryptococcus, um, uh, the best, easiest way to detect it is through the India ink or nigrosin. We are saying India ink or nigrosin because the two are, it's like if you have to use neutral red for gram stain and you don't have neutral red, you know that you can use saffron. You know that already.
Yes.
Hello. So it's like, even though they are two different things, but they can be used for the same work. So it's the same thing like the India ink and nigrosin. They are two different things, but they can be used for the, one can be used as alternative for the other. All right. So with the India ink and nigrosin, they are not true stains. And as we move along, I think I've captured that. They are not true stains. A true stain is that stain which has capacity to penetrate into whatever, is it an organism or tissue or cell that you want? It should be able to penetrate and impart a color to it. Is that not it? Now, you see, sorry, nigrosin and then India ink. They are just like suspensions of carbon suspensions. You see, they are just particles of carbon, and therefore they are unable to actually be able to penetrate into any cell and to impart a color to it. So at best, they can be used as a background staining in what you call negative staining. In microbiology, I don't know whether you know about negative staining. You know about negative staining? So now we are leaving semen analysis and moving to microbiology. But you see, in microbiology, when you say negative staining, it means that you are applying a stain which will ideally not stain the organism that you want, but will rather give a background staining. When it gives a background staining, it means that whatever, if it is an organism or fungi or whatever, it will lie unstained. But because that thing is unstained and the background is stained, you see a contrast. And you see in microscopy, you're able to see something because of the contrast, because you can differentiate this and that. Okay, so you are only staining the background and leaving the object unstained. That's what we call negative staining. And the principle is that most of the negative stains are anionic. When you say anionic, what does it mean? When you say anionic stain, what does it mean? I thought I was going to finish this in today, but let's move on. When you say anionic stain, what does it mean? It means acidic. It has a negative, an overall negative charge. It has an overall positive charge. It's cationic. This is basic, in fact, more than elementary microbiology. Whether you're a microbiologist or not, you should know this. When it comes to staining, even in histology, you do staining in histology, and they will tell you that stains are either basic stains or neutral stains or acidic stains. So those that are acidic stains, they have an overall negative charge, and they are anionic, and say they are acidic. And so acidic stains will stain basic elements. Okay, and then basic stains will also stain what? Also stain acidic element. That's how come you have basic stains staining the nucleus of certain, because most nucleus contain the DNAs, and the DNAs are just the ribonucleic acid and all those of them. They are acidic, and therefore, if they are acidic, how do you expect an acidic stain to stain them? Acidic stains cannot stain acidic elements. You see, those are the. You see, the thing is that don't let us be doing things the way we have been taught to do. The question is, what is the science behind what you are doing? And that makes you the scientist. Ladies and gentlemen, this semen analysis thing that I've taken almost 12 weeks, and that we could have taken 3 weeks to complete. Just how to do ABC. We could have finished this one in less than 3 weeks. But I want you to always appreciate or understand the science behind everything that you are doing. And that makes you the scientist. That is the difference between the technical person. That is not to undermine some Yeah. Sorry, I'm back. I'm back. I was just trying to explain the issue of negrosine, the use of negrosine. Okay, and I'm saying that if you understand um, the principle of again, I don't know whether. Okay. If you understand the principle of staining of India ink, this one also becomes very easy. And even though we are not doing microbiology, I'm hoping that anytime any issue of cryptococcal meningitis comes to your attention, you should be able to do it in your lab. And this is also like a bonus for the training, for this particular training. All right, so, and I was saying that the negrosine or the eosin, so the negrosine and then the India ink, they are on the same line. They can be used interchangeably. And I was also trying to go back further to also explain the issue of negative staining in microbiology, where we say negative staining is that one which does not stain the organism itself, but rather provides a background coloration or a background color that will give a contrast to the object to be studied or to be evaluated. So that the object will lie there unstained, and then the background has the color of whatever stain that you use. So that's what we call negative staining. And I'm explaining that in fact, almost all negative stains are anionic. And I was surprised that, unfortunately, you don't seem to know that anionic stains are also acidic stains. But at least you know that acidic stains will stain basic organs or basic elements. And then basic stains will also stain basic stains will also stain acidic elements. And I was saying that that's how can basic stains be used to stain nuclei, because nuclei is technically acidic because of their rich DNA. And therefore, you don't expect an organelle or anything that is acidic to be stained by an acidic dye. Okay, so in the same vein, most bacteria cell wall have a net charge which is negative. Bacteria has a negative net charge, a cell wall. And so if you use an acidic stain, which also have a negative charge, what means is that as the stain attempt to enter the cell, there's a repulsion, not exclusion. There's a repulsion of a sort. So instead of a negative, the stain entering the organism to stain it, the stain is a negative charge. The cell wall is also a negative charge. So there's that kind of repulsion. All right. So at the end of the day, the organism doesn't stain, but the stain will continue to stain the background of the slide, and the organism will remain unstained. And the background. These are, I'm sure it's very simple to demonstrate, but the science behind it, you should know. You know the science behind why acidic stains provide a basis for negative staining. Okay. Now, when it comes to the India ink and the negrosine, they are also negative acidic stains. But I've said that technically, the negrosine and then the India ink, they are just fine particles of carbon. And so because they are fine particles of carbon, technically they cannot even stain anything. All right. So they provide a background staining, and therefore they become negative staining. But what is important with the Cryptococcus is that Cryptococcus is heavily encapsulated. That's how it has a huge capsule. Okay. Now, and so the capsule is there. So the capsule itself will ordinarily will not allow stain to penetrate. And then the organism to, sorry, the stain to is negative, is a negative stain. That's a negative stain. It's negatively charged. So they have two things working together. Just as we talked about the dye exclusion and then the membrane integrity. So the stain is because it is acidic stain, is going there is also already is being hindered. And then the capsule will also repair it further. So it creates what we call a halo. Who knows what a halo is? Rhoda. Is Rhoda there? Rhoda, are you with us today? Yes, Rhoda is there. Rhoda, or you are sleeping? Who can help us with a halo? Are you hearing me? No response. Are you hearing me? The first, are you hearing me?
Yes, Grandpa, we are hearing you.
What is a halo? How many of you are Catholics? Catholics. How many of you are Catholics? Any Catholic on the platform? Or you are denying your faith? No, Catholics, they have a lot of saints. St. Patrick, St. John, St. Peter, St. whatever, St. whatever. What is unique when they are drawing or they are showing the pictures of the saints, or even Jesus Christ, or Mary, or St. Andrew, or St. What is unique about pictures of the saints and Jesus Christ and then Mary, as is shown by the Catholics? Yes, Kinsley.
Holy.
They live.
Yeah, they live what?
Follow me, holy or secret.
Holy. I say,
Yes.
what is unique about the pictures of Jesus and Mary and St. Peter, St. Joseph, the saints?
Hello.
So when they draw them, they leave a certain
Hello.
white around their head. Is that not it?
Yeah.
Oh, you haven't seen some before. Any?
Yeah, we see when they leave some small space to be in the hole.
Hole.
Yeah, the
No.
portraits.
No, I'm saying that any picture of Jesus or Mary or St. Peter, St. Patrick, St. whatever, they leave a white distance. I think it's like not a rainbow of a sort, but some white distance around their head.
Like to be.
You haven't seen some before. Rhoda, where are you hiding? And that's a halo. That's a halo. So with the Cryptococcus, because it has a very huge capsule, and the Indian ink too is also not a strong dye, and it doesn't stain very well, and it can at best be used as a negative staining. Then the capsule will push the stain further away from the cell wall or the capsule of the organism itself. And so you see that between the cell wall and then the stain, where the stain is, there is a space. And that space is a clear space, whitish space. I hope you can imagine that one. I don't know how to give a talk on that. That's why. So, but you can imagine that. So you see that the background, the organism is there, and usually you see that Cryptococcus is also a pathogenic yeast. So, and yeast, you know that they are usually they have the daughter cell attached to one cell. So you have a cell. I'm sure all of you have seen Candida before. So Candida, you have that ovalison and then another one on top of it. Okay, and it gives you a figure of 8. All right. So once you see, you get that as a structure of the Cryptococcus, and then the staining, the outside is black because you're using India ink, which is blackish, or nigrosin, which is also the same thing, almost blackish. So it will have a background, and then the organism will be lying there, and in between the background and then organism, there's a space, which we call a halo. So it is very interesting. You can't miss it, even if you haven't seen some before. Once you have this in your mind, if you have CSF, there's suspected cryptococcal meningitis, which is also very common, especially in immunocompromised individuals. Immunocompromised individuals with HIV, a lot of them will have cryptococcal meningitis. So you are a scientist, you are in the lab, and then there is cryptococcal meningitis, CSF, and comes to your lab and you can't do it, then it begs of your status. You have to do something. So you just the CSF is usually fluid. Of course, you take some and then spin, and then for deposit, you take a drop of the deposit, and then a drop of India ink if you have it. Okay, and then you just mix the two. You apply a cover slip, and then just leave it about 1 minute, as the case may be, because it's a wet mount, for it to stabilize, and then examine. If it is positive, you see critical body-shaped organisms with a clear white distance around them, and that is the halo. And then the background itself is black because you are using India ink, which is black. And then, or you are using nigrosin, which is also black. It is something that a scientist should never be able to, should miss this one. And so if the cryptococcal meningitis, you don't need culture. You don't need culture because ordinary culture, the normal culture will not pick the cryptococcus. You see, and so that is it. So I'm just using that one to bring your attention to the fact that eosin, when it's combined with nigrosin, the nigrosin is only going to provide a background because nigrosin is technically a negative for negative staining. Okay, and it's also technically like carbon, and so it will not enter into the cell. All right, and so once it's not entering the cell, and the eosin is the one which is either to enter or not to enter, then you see that the eosin too is pink, and then we have a background of black. Don't you think that it makes the visibility more easier, as opposed to where you have no counter stain? So you apply the eosin, and then you are seeing it as a red, the sperm staining red. Once the sperm is staining red, it means that, or pink, it is picking up the eosin. And once it's picking up the eosin, it means that the cell is dead. If it were not dead, the cell memory would have prevented or excluded its entry. And so I think we did that last week extensively. And so we said that the dead ones will be stained pinkish because their membrane have lost their integrity. And for that matter, the eosin is able to enter and then stain it. The ones which were lying down dormant as though they are dead, once they are not dead, their cell wall is intact, and the cell wall will prevent or exclude the eosin from entering. And therefore, the head and the cell is the sperm cell itself will not be stained, and therefore to remain white. Against what background? That's where the black background also comes to play. Once the black background comes to play, once the white black, it makes the contrast red and black. It makes it very clear for you to see. That is all. That is all. So the principle behind the negotiation using the using and negotiation is very fantastic. All that I'm saying is that there's a recommendation to add negotiation to using, even though using can be used alone. But once you add negotiation, it improves the contrast. And therefore, for that matter, it also improves your ability to observe. All right. So the principle behind the UOC negotiation staining for vitality is that healthy or live or vital sperm. When you say healthy sperm, it means that a sperm which is not dead. Or life. I'm bringing all this up because it depends on what literature or what book or what document you may be using. So those words that can be used for the same thing, I try to bring them together so that whichever way you take it, you understand that it's the same thing. So a healthy sperm or a live sperm or a vital sperm will have an intact membrane, and for that matter, will also exclude the staining by UOC, and therefore they will appear white. They will appear white. While the dead or non-viable sperm with compromised or damaged cell membrane will absorb the UOC and therefore stain pink. I think this you've said over and over again. All right. The negrosin is an aqueous blue-black acidic stain, and I've told you the influence of the acidic stain. Acidic stains are used as negative stains because of the fact that they are negative. They have negative charge. The negative cell walls of bacteria will repel it to some extent, and therefore will not stain, and therefore will be able to provide that background staining alone, which is described as negative staining. Okay, so yes, it is important to state that negrosin is just fine particles of carbon, just as you have the India ink. Okay, all right. So in the sperm vitality test, negrosin is used in conjunction with eosin to stain. So with the eosin stain to create a dark black background, which is negative staining, that improves the contrast between the background and the sperm, whether it is stained or not. All right. If it is stained, it becomes dead, and therefore to stain pink against a black background. If it's also unstained, then it will remain white against also a black background. So there's something that you should be able to. So we went through this the preparation of UOC stain alone. So now here you also been introduced to UOC negrosin, how to add. You can use the UOC alone, you can use the negrosin alone, but you can also combine them and then use it as a one-stage method. That makes the procedure very, very, very simplified, very simplified. All right. So the staining is just very simple. You mix your sample, semen sample should always, for whatever test you are doing, should always be mixed. Don't miss that one. And then you remove an alicot, just a drop, about 50 microliters, and then you add another drop of the negrosin UOC stain that which you have prepared, and then just allow about 30 seconds. All right. You remix the semen sample before removing a replicate alicot. What we are saying here is that we always want, because of the variability, you always, whatever test on semen that you want a replicate, so that the replicate means that the procedure should be repeated. Okay, and once you repeat the procedure, if the result you get from, let's say, the first tube is varied significantly from the second tube, it means that there's a problem. But as much as possible, if the differences are very close, it means that you're on the right path. That's why most times you want a replicate. And then once you take a sample and you are going to take a replicate, always mix, because that small time that you left after preparing the first two, the small time interval between that one and the second tube that you're going to prepare, that small time, cells can begin to fall down or to sediment. All right. So at any particular point in time, if you take a sample and you're going to take a second sample, please mix it. That's what we are talking about. You're mixing once you are taking a second aliquot. And then just examine your smear, and then you tally the result of the dead one and then the live one. The dead one will be seen as stained, and then the live ones will be seen as unstained. All right. Now, you are always, it's recommended that you always look at about 200 spermatozoa. Why do you want 200? Because at the end of the day, you're only going to strike a percentage. If you're going to strike a percentage, why don't we limit ourselves to, let's say, 100, so that whatever you get over 100 times the 100 will give you your percentage. But you see, the more cells that you count, the higher the chances of you reducing your errors. I'm sure you know this as scientists. If you increase your numbers, then your error percentage of error will also go down. If you take a small sample, okay, if you take a small sample, then your error becomes very high. That's why it is recommended that right. I just saw a chart and I tried to check on the chart. Is the Rhoda who always gets it correct but doesn't want to speak? Rhoda, be speak. I mean, if you put it on the chat, I won't read. Next time I won't read. Just say it and let us know what you're talking about. All right. So the higher the number of sperms that we evaluate, the lower your errors. If you even take 10 sperms and use that to calculate your percentage, you are still going to get results, but your degree of error becomes very high, as opposed to somebody who is taking about 200 sperms from the same specimen. You try to just look at 10, and then you did your calculation on that. Somebody is looking about 200 and also calculating his percentage. You see that the person who looked at 200 and to the percentage has a probability of accuracy than a person who took the small numbers. So if you see 200 to at least 300, what it means that you may choose to do 50 or 100 or even 120. At any rate, the more the numbers, the more you become more accurate. Okay. All right. This one, we are also saying that eosine nigrosin staining is also called live dead spermatozoa. So if you read anywhere talk about live dead stain, it is the same eosine nigrosin. Live dead means that once you use the eosine nigrosin stain to stain your slides, you'll be able to pick out dead ones and then the live ones. That's all. So if you read about live dead stain, it is nothing but eosine nigrosin staining because of its ability to determine live sperms and dead sperms. That is also very simple. All right. And then the observation, I think you know this already. Nigrosin provides a dark background, which makes it easier to visualize the stains. sorry, the sperms. Under the microscope, live spermatozoa have white heads, and dead spermatozoa have heads that are stained pink or red. I think we said this over and over again. Spermatozoa with a faint pink head, it means that they are still dead. Okay, so if the head is faintly stained pink, it still should be counted as dead sperm. Now, if on the other hand, the neck is white, but the neck area is stained pink, what it means is that there's a problem with the neck, but which we call the leaky neck membrane. Remember that we are saying that the whole staining procedure is based on a principle of the membrane integrity. Okay, so if the neck area, the membrane is leaking, then what it means is that because it's leaking, it will also allow the eosin to move in and stain, but it can only, the stain can be restricted around the neck area, and the head area will still be intact. The head area will still be intact, and therefore the head area will remain white, but the neck area will stain pink. You don't, when you are counting, if you have done the eosin necrosis stain and you are observing under the microscope, once you see a cell which have the head area white, and head area white means that it is alive, but the neck area is stained, you don't count it as dead. That's all that we are saying. Okay, and these are some pictures for you. All right, so this one, you will see that the small area here is stained pink, but the majority of the area there is what? It's white. So we still consider it as life. This one is life. This one is dead because everything here is, this one is life. Okay, this one is dead. So, and you see that this one, the red and white color is coming out strongly because it has a black background. Okay, and that's the eosin necrosis. That's what the eosin necrosis does. Because it provides a background, it gives a contrast for you to be able to see your cell much better. Okay. So let's look at the steps for the calculation of sperm viability. So if, let's say you are counting 200 cells. So you look at a field, and for that field, every cell, all the cells there, you count them. So let's say in this field, you are getting, let's say, 15 cells. Out of 15 cells, how many are staining white and how many are staining red? Those that are staining white, they are all alive. So you don't even need to count that. But if you counted 20 and 5 of them are alive or are white, that means that 5 are live and the rest are dead. Okay, so you are counting 5 live and within a total of what, 20. So you'll be counting them until you get about 200. Then at the end of the day, after getting about 200, of the 200, how many of them stain white? Then if 100 of them stain white, it means that your percentage is the 100 which stain white, which were alive, over the total of 200. That's all. This is simple class 1 mathematics. All right. So you calculate the percentage of live cells by multiplying the ratio, and the ratio is the number of sperms which were unstained, and for that matter, which were live, the number over the total number of sperms that you counted. So it means that it is a total, both dead and then the alive one. They may give you the total. Out of it, how many were alive? So that is the ratio. And you multiply that ratio by 100 to give you the percentage. And this is, so if you decide to be able to give, to do 200, then your denominator will be 200. Okay, and then the numerator will be whatever number you get, multiply by 100. That's all. So this a simple class one example that I'm making. So if for a given sample you had 120 out of the 200 sperms that you counted, 120 were on stain, and for that matter they were live. Then it means that the result will be 120 over 200 multiplied by what? Multiplied by 100. 120 of them were live over a total of 200 sperms that you counted. Multiply by 100, that will give you 60%. That is your vitality rate. Okay. So some key points to note on the eosin staining. It is important to know this because when you go to morphology, you'll be encouraged to do staining, because to be able to know the cells very well, you should stain them. Now, eosin necrosis stain has been recommended as one of the stains that can be used for your morphology assessment. So what it means is that once you do your eosin necrosis stain, you'll be killing two birds with one stone. You can use the necrosis eosin stain to do your vitality. You can use the same slide also to do your morphology assessment. That's why I'm taking my time on the eosin necrosis thing over again, because it's going to provide you another opportunity to use it. Okay, and once we get there, you are not going to come back. As you know, eosin stains dead sperm. Okay, eosin is a dye that can only enter cells with damaged or permeable membranes, which are the dead sperm cells. And so eosin will do that. Necrosin provides background contrast. Necrosin is a dark black, and you know these are the key points. It means that they are the very things that we talked about already, only trying to go back on them. So it's a black dye that's in the background of the slide, making the sperm hairs stand out clearly under the microscope. The interpretation is that live sperm appear on stain or white, and then dead sperm also appear red stained. Okay. So these are the important things that we needed to capture on that. So now we go to sperm morphology. Sperm morphology. So we're done with the vitality. We've done the motility last week, done with vitality. And then one other parameter is the morphology. So the practical evaluation of sperm morphology involves the following steps. You prepare a smear of the ejaculate on a slide, you air dry, you fix and stain. The morphology, most of us, what we've been doing all the while is just you do a wet mount, and then you attempt to do morphology assessment from the wet mount, which is a very, very weird way of assessing the morphology. All right. So we try to do the right thing as much as possible. And so you have to be able to know that sperm morphology assessment, the morphology assessment will require staining. Okay. Now, in preparing a smear of the ejaculate on a slide, once you prepare your smear, you have to air dry it. And these are the procedures we use routinely in hematology. So now instead of the blood, it's going to be semen. You know that blood and semen have semblance. Of course, you know that the blood contains cellular portion and then a plasma portion or a fluid portion. The same way, semen has a cellular portion and also a fluid portion, which you call seminal plasma. And so that kind of correlation is there. So to prepare the smear is the same process as you use with a blood smear. All right. And then once you prepare the smear, you air dry. Air dry means just leave it on the table. Once the air blow on it, it will dry. That's called air drying. Okay. If you do your Z10 stains, Z10 stain, or for, okay, let me go back straight to gram stain in the first place. If you do any gram stain and you finish with the staining, what do you do? The last stage after the staining, apply your counter stain, and then you've also washed. What next happens to the slide?
You blot.
You blot to do what?
To remove the excess water.
And to do what?
For it to dry.
So you should be very technical. So you are blotting it to dry. So that's called blot drying. So you blot once you say air drying. In the air drying means you put it on the table and then air will blow in it and it dries. So that's the narration. But once we say air drying, nobody is going to, if you are writing for examination or whatever, if you say air dry, nobody is going to ask you to explain it. But if you say that, oh, you leave it and then you leave it on the bench and blah, I mean, it's just a narration and you're not going to get any technical point for that. All right. So once you blot, you are blotting it to dry. So that's blot dry. So you blot dry. Okay. But if, let's say, the same gram stain, if you did it for CSF, you don't recommend blot drying. You know, CSF is a very delicate sample. And usually also sometimes the organisms, the load of organisms or the concentration is so scanty that you know that one of the disadvantages of blot drying is that as you blot, the filter paper will pick some of the specimen, whether you like it or not. The filter paper will pick some. And if, let's say, it contains just one organism somewhere, and you blot, and as you blot, the filter paper pick the very portion that contains that one single organism. The filter paper picked it up. What are you going to read? You are going to read your result as negative. Nothing is there. All right. So specimens that are so delicate like CSF, you don't blot dry. What do you do? What do you do? You've done your gram stain. For ordinary gram stain, if it's a wound swab or HVS or even a gram stain from a plate, you blot dry, no problem. But if you have delicate samples, and I was going to go to a Z10 stain. If you did a Z10 stain and you did a blot drying, that's a disaster. Okay, so if you blot dry, and you know that AAVs, if you get even one single bacterium, let me put it that way, on the field, it is still positive, isn't it? If you comb the whole field and you got only one, will you report as positive or negative? Hello?
It's positive.
It's
Slide.
Yes, good. If you blot dry, Z10, if you blot dry, and like I've said, any blotting procedure, the problem is that as you blot, an aspect of the smear will be picked up. That one there, nobody can prevent it. It will happen. If you have a smear that contains one AFB and you blot, and then the smear, what do you call it? The filter paper picked the only single AFB that was on it. How are you going to report as positive or negative? Please, let's hurry up. These things, they are not part of semen analysis, but they are important for all of us. Because one day, you will be confronted with it. So you see that Z10 slide will be reported as negative. So the patient will go away. There will be no treatment for the patient. The patient will go, but by the next time that he comes, the patient's condition has deteriorated. Similarly, if you are doing the blotting technique for a slide, a certain slide, which is let's say more than 3 pluses positive, what it means is that every field of that smear contains several bacteria, okay, or the AFVs contains a lot. So if you blot dry, if you blot, the filter paper is still going to pick some aspect of the smear, and you know that the positive, that small portion that this has also picked a lot of the AFV organisms, has picked a lot of them. Now in our labs, I don't think that everybody does one filter paper, one slide. Sometimes even the filter paper will be used for even a whole week. That same filter paper for the blood will be used for the whole week. So if you have a positive slide, which was, let's say, which was highly positive with 3 or 4 pluses, and the blotting also picked some aspect of the smear and has carried some positive organisms on the filter paper. If you have another slide which you're also going to blot, don't you have the likelihood of transmitting or transferring the positive AAB from the previous slide onto the new one, which is probably negative? It's not possible.
Yeah, very possible. More
Very possible. So somebody who has no AAB is going to be reported as having AAB. And you know that once you are reported AAB, you are going to be put on medication for the next 6 months or yes, and you see that you see the harm that you've done to somebody. So all that I'm saying is that even with a blood drying, you should be very circumspect and you should be very scientific to know which one to blot and which one not to blot. Okay, so yes, the blood dry is good if you want it to because if you don't dry it, all stain smears are going to be examined on the times 100. The times 100 is oil immersion. So once the thing is wet, how are you going to apply your oil? Oil and water are immiscible. So that's also the science behind that one. So the slide must dry. How means it should dry is what we're talking about. If you either blood dry, and I've told you some of the challenges with the blood drying. The safest way is to do what? If you want to dry again without blotting. Especially if you are in hematology. You did a thin film and you stay by your Leishman. Have you ever blotted Leishman stain slide before for blood smears? Have you ever blotted Leishman stain smear for film comment? Have you ever done that before? Has anybody done that before? You don't have to do that because once you do it, you are going to distort the morphology of the cells. And so you don't blood dry. All that I'm saying is that there is also a means of drying your slide other than the blotting. And what is it? Ishak. Ishak, I thought you are going to answer. If you stain your slide and you have to dry it, all of you know about the blotting, which is very good. But I've told you, I've explained to you the challenges or the limitations of the blood drying. And I will draw your mind to hematology. Almost everybody does some hematology of a sort. And you do a thin film, you stain for either film comment or differential count. These days, because of your auto analyzers, nobody does differential count. But technically, if you're going to do a film comment, you also do an assessment of the cell count so that you can look at the parameters that you got from your analyzer. If the parameter you got from your analyzer is completely different at variance with what you are seeing on the film, you should know that there's a problem. All right. So, and I keep on saying that you should behave, all of us, you should behave as scientists, so that whatever you're doing, you should know the science behind them, so that when there's an error, you're able to pick it up. So that you don't give yourself the opportunity for any doctor to come and challenge you. Before you give out any result, you yourself know that this result is credible. But if you don't know the science behind them, you will just give out result because the machine has given you. And then you end up disgracing yourself and the entire profession. Right. And I thought that most of you do hematology. Most hematology, Leishman stage, you slant it, isn't it? You slant it. And once you slant, what will happen? If you slant a slide, and I come back to microbiology or whatever stain that you do, if you finish with the staining, you slant it. When you slant, what will happen? Don't tell me that all of you don't know what I'm talking about.
Grandpa.
Yes, sir. Yes, sir, Bernard.
Yeah.
So
Bernard, if you do the slanting, yeah, the water will drain off the slides.
The water will drain. And once it drains, what will happen? Once it drains, what will happen? It will dry. So that's drain dry. You see, as scientists, like I keep on saying, I want the science in you to explode. The science in you should always talk for you. Okay? So I said that when you blot, it will dry. So that's blot drying. And then the other one is when you allow it to slant. When you allow it to slant, all the water will drain. And once it drains, it will dry. So that's drain dry. You see, so because once you are a scientist, you should talk scientifically and the technical words should come out. Not that you will slant it and then it will dry. If you say you have only made a narration, you haven't brought out the technical aspect. Okay. And I want all of us to be proud of the profession that we are in, so that once the doctor comes in, you are going to talk your technical distance, and the doctor will just stand there for you, because otherwise they will always be coming to you and be challenging you. So you also drain dry. So so there's air dry, there's drain dry. Okay, air dry is normally where you put it on flat horizontally on the table for it to dry. That's air drying. So if you finish with a slide and you put it on a table for it to air dry, you're going to create a lot of artifacts, because now the water, instead of draining, will just dry on the surface of the slide, the stained slide, and then they're going to create artifacts on it. So you cannot air dry after staining. Okay, and then once you have also prepared your smear, you cannot also drain dry, because once you slant it, you prepare the smear. Normally, the smear may not be firm on the slide. So as you slant it, it means that a lot of the cells will move downwards. And therefore, there's going to be that kind of uneven distribution of the cells on the slide. And therefore, you cannot, when you prepare a fresh smear, you can't also dry it. Sorry, you can't drain dry it. So you should know how to use the words and at what time. So after smearing, prepare your smear, that one you air dry. You don't drain dry. Also, after preparing your stain, after your staining process, you don't also air dry. You can also drain dry. Okay, all right. So you air dry and you will fix. When you are air drying, apart from drying, it is also the slide is somehow also fixed, but it's not a firm fixation. Okay, if you after air drying, the cells are not well fixed on the slide, so you cannot deem the air drying to be also fixation. So after air drying, for the cells to be properly fixed on you need a fixative, okay, or a fixing agent. And here, normally in the labs, is usually methanol. Okay, methanol. And you see that the big difference between Giemsa and Leishman. Okay, now Leishman is alcohol based. And so once you are using the Leishman, you see that once you are staining, you put the Leishman stain on it for the first 2 minutes or so. The first 2 minutes, the stain is not going to stain anything. It's rather the alcohol in the Leishman stain, which will now be fixing the cells. And now after 2 minutes, now you are going to add your buffer. Okay, you are now going to add your buffer. So now the buffer is now going to provide the aqueous environment for the dye to be able to now do the staining for you. Okay, so these are the things I want you to understand, and these are all scientific. These are all very, very fantastic. So how to do it there? An SSS leaver who comes to the lab, if you teach a person how to stain and the person will be able to do all those things for you. So very soon the person say, oh, a lab question, you understand? But we shouldn't also be towing that same route. That you know how to stain. And when somebody even asks you, so what's the big difference between the staining by Giemsa and then Leishman? So you know that in Giemsa, you have already diluted. You do the 1 in 10 or 1 in 20 dilution. And so the alcohol base is already diluted out. And so if you want to now stain a slide by Giemsa, then you have to also prefix it. Those of you who do thin and thick smear on the same slide, you will see that where you have your if you want to stain all the thick and thin smear by Giemsa, okay, then it means that the Leishman side, the thin side, should first and foremost be fixed. Because Giemsa that you are going to apply, Giemsa has already been diluted, and therefore it's water-based. So if you use the water-based to stain the whole slide, including the thin film area, the water in the Giemsa is going to hemolyze the red cells. Meanwhile, at the end of the day, you want to assess the morphology of the red cells. These are the science behind the things that you do. And if you don't appreciate some of these things, master, you will be behaving like ordinary bench trained technician. Okay, and I'm not. You see, I keep on saying that this semen analysis we could have finished long time. You could have finished this in a long time. So I talk and talk and talk just to ensure that you understand certain things that will help in your practice, not just semen analysis. Okay, all right. So in doing the semen morphology, you are going to prepare your slide just like you do for a blood film. You prepare your film and then you air dry, you fix, and then you do your staining. And then the staining could be by whatever stain that if you want to use Giemsa or Leishman or what do you call it? Very soon, I'm going to introduce to what we call the Diffquick. The Diffquick stains. You see, and like I keep on saying that I'm trying to give you information that will help you to work anywhere apart from, even because in Ghana we are limited in the, so a lot of things we are learning now may not even find them useful. If you happen to be working in an outside laboratory where everything is there, you see that the person will also know that, hey, master, you know that you know. Okay, so you have to learn some of these things so that if also, okay, if you get a collaboration, somebody comes to you, oh, you want you to set up an andrology or semen analysis bench proper. Then the things that you should have gotten which you don't have, you have to make sure that you now bring them to your lab so that anybody coming there will know that you have did everything that can be done anywhere in the world when it comes to the semen analysis. That's why I'm going extra mile. Otherwise, the semen analysis all of us do in our various labs, you could have taken just from 1 day to finish everything. Okay. All right. So after the staining, then you, of course, you are going to look at the morphology of the cells, and therefore you need the 1,000 times magnification. 1,000 times magnification, means that the oil immersion. The oil immersion is times 100, and then the objective lens is times 10. So I've always intentionally tried to use these ones interchangeably so that you don't get confused if somebody is talking about, let's say, 400 times magnification. Once the person talking about 400 times magnification, you know that he's talking about times 40. All right, good. So the same way, once you have also finished staining and examined, you can also either mount or mount. When you say mounting, I'm sure those of you who have a little experience with hematology, with histology, you know that in histology, after preparing your slide, you have mountains. You mount the slide, and then once you mount the slide can be kept for years, anytime you need it, because it's going to be permanent. So sometimes you may mount them so that you can keep them for your reference or for your teaching or for future if you want to use it to for other studies. Otherwise, if for the routine use there, you don't need a mountant. All right. And then, as I've said already, with all the assessments, the more the number of spells that you assess, the better your report. So you may have to also now examine about 200 sperms and then look at them one by one. And you have done the morphology already. So look at every cell and then look at it and see whether it's normal. And we said that the Street-Kruger criteria, which is now the recommendation by WHO, is saying that before you say that the cell is normal, the head, the neck region, the tail region, the principal piece, the end piece, everything should be in conformity with established the definitions. Where there's a smallest deviation, it means abnormal. That's how come the normal range has been brought down as much as 4%, so that you are ruling out any sperm with the least deformity, any cell with the least deformity, you rule it out. Okay, and after that, the normal ones that we get over the total sperm that you examine, which is about 300, multiplied by 100, will always give you your percentage morphology. Okay. So the preparation of the ejaculate. So we said that one, you have to prepare your slide dry, and then but the following ones is just trying to take you through the step also further one by one. How do you prepare the ejaculate? So of course, the specimens should have liquefied and should mix the sample very well and remove a small aliquot, which is about 10 microliters, and then just place on a slide, and then you do use the feathering technique. I'm sure you know the feathering technique, where you put, let me take it to the next slide. Yes. So just like you do for your hematology. And how many of you are able to prepare hematology thin smears? I'm sure everybody is able to prepare a thin smear for hematology, blood smear. These days, that one you don't do it. You don't prepare thin smears in your lab.
We do.
You do. Or you don't. Ima, I thought you were answering something. Ima, you don't prepare thin smears in your lab. Hey, Joe. So you just put a small aliquot, small drop at maybe a slide. You put it at one edge here, and then this is a dragon slide, or the people call it spreader. Okay, so you put your dropper there, and then you put the slide at about 45 degrees angle, and then you draw it back. This is the arrow. You draw it back so that it touches the drop. So if this were blood, the same thing that you do with the blood, and this is a smear, semen, the same thing. So you draw your dragon slide or your spreader slide backwards to touch the specimen. And then once you tie the specimen, it will move along the entire edge of the spreader. And then you move the spreader forward. As you move the spreader forward, this one will be the nature. And this is called the feathering technique. So this place will be thicker. As you move along, it will thin out. It will thin out up to this point. And then you get a smear. And this is the same way you prepare your blood smear. Okay, so if you have not been preparing blood smears in your lab for whatever reason, I think it's also a skill that has to be developed. If you don't practice it, you can't do it. That's the fact. So even if you're not doing it in your lab, now individually, there's always a blood sample in your lab. Try to be preparing blood smears, thin smears. And the more you do it, the more it becomes nicer. The more it becomes nicer and easier. Some people can just put the slide, not even on the, even in their palm. Okay, the slide in your palm, put the specimen there on your slide. Those are very skilled. They will just give you a smear. You look at the smear and see that, wow, this is a masterpiece. Right. So try to do some, and as often as you do it, you get a skill to do that. And this is a thin smear. In the same way as you do for blood thin smears. Okay. All right. And then the air drying. I said that after the smear, you put it on the table, all right, horizontally. You don't slant it. If you slant it, what will happen is that because the smear is wet, the cells will begin to drain towards one end. Okay. All right. So you just put it flat or horizontal on the table, and then it will dry, and that's called air drying. And then the thing is that, especially with the semen, the air drying has some challenges, including the changes in the sperm dimensions. You know that the sperm has dimensions. Remember that we talked about the head, the dimensions of the head, the tail, and then all of it has dimensions. As the thing dries, what do you think will happen with respect to the dimensions? What do you think will happen? Hello? I hope you are following me properly. Ladies and gentlemen, are you following the discussion?
Yes, Grandpa.
Hey. So I'm saying that once you air dry, air drying has some morphological, they introduce some morphological defects, and it got to do with changes in the sperm dimension. Sperm dimension, you know that the head is supposed to be between 5 to 6 microns, and then so forth and so on. The tail is supposed to have 60 micrometers and so forth and so on. So once you air dry, the dimensions are likely to change. And what do you think the changes will be? Hello? From your own, listen, I mean, just from your own mind. Amelga, if you are talking, talk loud. Hello, Amelga.
Hello, Grandpa.
Yes, sir.
I didn't get your question, please.
Oh, I said that after preparing the smear, you need to air dry. And I'm saying that the air drying could also potentially introduce some morphological defects as the thing is drying. And one of the things is that they will cause changes in the sperm dimensions. And we said that the dimensions were the head, the measurements of the head, the measurements of the tail, and this, they all change. And I'm saying that what do you think will be the nature of the change? Ishmael.
Some of the cells, they will shrink.
They'll shrink. They'll shrink. So, and that's correct. So, as with the shrinkage, so it means that a dimension which is supposed to be between 5 to 6 can now become 3 to 4. The dimension which is supposed to be 60 now can become around 40, 45. And so So those things must be borne in mind, that if you don't take care, then all your sperms, according to the criteria, will all be abnormal. Okay, they'll all be abnormal, because if the head is supposed to be 5 to 6, and now after staining you are getting 4 to 5, you think that no, it means that because the criteria is supposed to be strict, 5 to 6, 5 to 6, no more, no less. But this one is giving me 3 to 4, therefore it means it's abnormal. But you should appreciate the fact that because of the drying effect, it introduces these changes in the in abnormality, in the sperm dimensions, and that will help you to now know okay, because I know that the sperm dimensions can reduce slightly because of the air drying. Then that it means that you are applying your science. All right. Then expansion of immature sperm hairs. Immature sperms will have larger hairs, and this one, instead of shrinking, they will rather become bigger. Okay, they will rather become bigger. And then loss of small cytoplasmic droplets. You remember cytoplasmic droplets? If they are small, you may lose them. However, the larger residual cytoplasmic droplets will be retained. These are all things that are likely to happen after the drying. Okay, right. And then fixing. Fixing, normally, I've said that you normally after you have air dried, it is not properly fixed. I've said that already, and you need to fix it. So you can introduce it to 95% methanol, and 95% methanol is almost absolute methanol. Okay, once it is more than 95%, it becomes absolute. So methanol you produce to 1 hour, and this becomes necessary if, let's say, you want to do your staining later on. Okay, you want to do your staining later on. Then you can stain it. You can put it in immerse it in your methanol for about 1 hour. After that, you take it out, you allow it to dry, and then I can keep it for any time that you want. Then you stain it. But if you are going to stain almost immediately, then even the fixation can even be within 3 to 5 minutes. Staining, and then you put it into the staining process. All right. Staining. So now you have prepared your smear, you have air dried, you have fixed. The staining, there are a lot of stains that can be used. So the perpendicular stain, I'm sure you have heard about it. It's a long process. It's a long process. And that one is useful if somebody wants to do, let's say, some research. You are doing a research procedure in semen analysis. That one you are going to publish. And once you are going to publish, you need to give yourself the highest recommended technique, which is perpendicular. So perpendicular is what is normally cut short as the PAP. So you remember that in cytology, they take the endocervical smear and then they do the perpendicular staining, and so they call it a pap smear, because the smear is going to be not stained by perpendicular staining to examine if there are any what do you call it, cancers or any malignancies. Okay, so that is the pap. The perpendicular is the pap smear. Okay, so the same staining procedure as what can also be used in the semen morphology assessment, but that's a very long process. And I'm saying that this one, if you are going to use it for any research work, then you may do that. And then otherwise, you can also use the GIMSA. You can use the GIMSA because you have already fixed. If you are not going to use GIMSA, then you can use. If you are not fixed, then you are going to use the Leishman, because the Leishman contains, like I tried to explain, Leishman contains the methanol already. Okay, and therefore the methanol will do the fixing for you before it now stains. But if you are already fixed, then you can use the GIMSA stain. Or there is the diff-quick rapid staining method. The diff-quick rapid staining method, I'll take you through this one in the next couple of slides. And then also, you can also use the using nigrosin. That's also one of the simplest tests you can do. And I told you that the using nigrosin will now have a dual purpose. One for the life and death determination, and then the other for the morphology. Because once you have the nigrosin using, it gives a proper shape of the sperm structure, and that can be used to assess the morphology. Okay, all right. So that one. So you know we have ruled out the perpendicular because of its complexity, and you know GIMSA already, and then you also know using nigrosin. So what is next is to take you through the diff-quick. The diff-quick is also a Romanesque stain. What is a Romanesque stain? Romanesque stain, what is it? Hello, somebody should help me. A Romanesque stain, what is it? Moses, today I haven't heard you. I haven't spoken today. Moses. My Moses. Moses, don't tell me that you put your listener on and you have left. Some of you just put the thing on and then you do your own thing. You don't listen to anything. Is Moses there? Class president, Nadia, what do you know about Romanesque stain? Can anybody help me with Romanesque stain?
Grandpa,
Yes, sir.
Come,
I
let's
think
do this.
I know Romanowski stains usually contain eosin and methylene blue absorb B or
Great.
something like that.
Great, great, great. So you have a couple of them: the James's, the Leishmans, the Janus, the Wrights, and all of it. And these things are basic things that you'll be taught in any hematology, even those at certificate level. You'll be taken through Romanesque stains. Okay, so basically, you will have your methylene blue and then eosin as the principal ingredients, and various scientists have prepared that combination in various ways, and that has given rise to the differences: the Leishman, the Jimsa, the Wright, the Jenner Wright, and all of you. They are all combinations of that. So that's so any staining procedure that has methylene blue and eosin is basically also a Romanesque stain. And so diff-quick is one of them. So you know that the diff is coming from differential. You know that if you do your Leishman staining or most of the Romanesque stains, they are able to help you to differentiate cells based on those that are eosinophilic or neutrophilic or what have you. You understand? And so this one is quick because you know that traditionally most of the slides, most of the stains, they take you a couple of minutes. Okay, may take you a couple of minutes. I'm sure even if you want to use Leishman, it may take you up to about 20 minutes to finish. Okay, but this one, you can complete it within less than 30 seconds. And so it becomes a quick way of differentiating cells. Okay, that's why it is called a differential quick. And it's a very rapid means of staining. And basically, as you go through, you see that the solutions are made of using and the methylene blue, and therefore automatically they are the foundational ingredients for Romanesque stains. Okay. So sequentially, immerse the slice in a stain solution 1 for just 10 seconds, in solution 2 for 5 seconds. Now, so that gives you just about 15 seconds. And then you just wash, and then you get your slide. So by the time you finish, everything is just about 30 seconds, as opposed to some 15 minutes or 30 minutes that you have to use to do the traditional Romanesque stains. Okay, all right. Good. So just as you have with, let's say, your grams, I keep on referring a lot to microbiological things because my greatest specialty is in microbiology. Okay, so I have my biases there. But as much as possible, there are certain things that a scientist, irrespective of whether you are a microbiologist or whatever, you should know. And sometimes I try to also make sure that I bring you to that level, that whether you're in biochemistry or whatever, as a medical scientist, there are certain foundational knowledge that you shouldn't say, oh, because I'm in histology or I'm in pathology, I don't know. Okay, you are first and foremost a biomedical scientist with a broad-based knowledge in all the disciplines before you try to specialize in your department. All right. So please don't think that I'm too harsh on you. I just want you to at least make sure that nobody bullies you. Okay. Right. So you have normally, if you want to buy, you have the difficult as a kit. And yeah, so this brand 1, 2, 3 here is different from this brand, but you see that they are all, this blue, this is pink, and this is light blue, eh? Yes, this is light blue, and this is pink, and then this is deep blue. The same thing here. They are from different. It's just like if you have your gram stain kit. Now people get the gram stain instead of preparing them locally in their labs. They buy the kit, and you see that they may be coming from different sources, but you see that you have your crystal violet, you have your iodine, you have your decolorizer, and then you have your counter stain, irrespective. So a kit for diff quick kit will always be something like this. All right, you have interestingly, the blue one is just to give you some listen. The blue one is your fixing agent, methanol. But just as we said about the tinting. The tinting is just trying. You have your main ingredient, and then you just give just a little color to it, just to as we talk about the text fluid. We say the text fluid is just 2 or 3% your acetic acid, and then you tinge it with just a little about ginseng, and then just give a little color to it. The color should not be too much because just a way of identifying it. And we also talked about the sodium bicarbonate formalin reagent mixture, which is your diluting fluid for your semen. And we said that after preparing, you can also give a little tinge of crystal violet to it. So the same thing, we have methanol here, which has just been giving just a little color. You know that methanol is not colored. All right, but so for every kit of a diff quick, you have a fixative, which is methanol. And the methanol is always tinged light blue so that it will give you impression as if that is some reagent. It's nothing. All right. So you have a fixative, which is usually blue, and then you always will have your solution 1 or solution A or whatever, your first solution, which is the EOC. Okay, and then the next solution is your methylene blue, it's also blue. Okay, so whichever way that you have, this is how you're gonna be. And then this is the way to go about it. So once you have your reagent, you can now localize it. So you have your reagent, then you can now put, because you are going to dip it. Okay, you are going to dip the slice into it. So once you're going to use that slice into, if you have a container, something like this, you cannot be applying your slide into the entire reagent. So the whatever reagent that you get or you buy, you now have to put them into containers like this, which you can use. All right. So you have for this, you have your caps. So you remove the caps, you cover them, and you remove the caps, and then the first one will be your fixative. Okay. So you just already the slide has already been dried already, and also fixed already. Okay. So once you're going through this session, the fixing is going to be very, very just some few dips into it. Okay, so you dip it into the pot one. The pot one is the fixative, all right, which is your methanol. So you dip it in for 5 times, and each dip is just about a second. So that will take you just 5 seconds. Then you move on to the next one, and then so forth and so on. So you move on from here, dip, then the next one to the next tube, dip into the next one. Every dip, when you finish, this is supposed to be your filter paper. Okay. So the slide will just let me take you to the next one. So as you remove from this from the reagent, you drain this in excess by tapping it on the filter paper. Okay. As you tap it on the filter paper, not slant it, just tap it. The excess will just move away, and then you take it to the next slide. Take it, all of them 5 times, 5 times. And 5 times each is just about 1 second each. So that is how the procedure is. Very, very quickly, and the same across, the same across. And then once you are finished, the last one, once you finish, you of course wash. Okay, once you wash, then you allow the slide to slant. You don't blot. Okay, you allow it to slant, and once you slant it vertically, the whole thing will drain and to dry. Okay, and you are done with it. So the diff quick is also the fastest means. Even if you have your own methylene blue and then you have your own USC, you can still do your diff quick method. If you want to also buy, you can buy a kit, and once you buy the kit, you can also use it. But I recommend that if you are able to get your using Negrosin, that would be best, because you can use it for your vitality and you can also use it for your morphology assessment. All right. Okay, so let me take this last lesson. Alternate method. So now you see that we talked about perpendicular and say that if you want to do perpendicular, of course, if it's for research work or something, perpendicular is the recommended method. Okay. Now, for routine work, I don't recommend the PAP. So you can also use GIMSA, or you can use the DiffQuick, or you can use the using Negosin. And then last one too, you can also use carbofucin. What do you know about carbofucin? What do you know about carbofucin in the lab?
It is used to stain AFBs.
Fantastic. It's used to stain the AFBs. That's the primary stain for your AFB. What's the key ingredients in carbofucin?
Basic fusin.
Good. Good. Very good. And what?
Phenol.
You are correct. And phenol, great. Great, Christian. Today you stole the show. And you know why it is called carbofucin? Can you tell me? That's a great show anyway, Christian. You've done so well. And why is it called carbofucin? Okay. Right. So, like you rightly said, phenol and then basic fucin. There are two things that make up the carbofucin. The phenol is carbolic acid. Okay. Phenol is carbolic acid. And of course, basic fucin. So once you combine carbolic acid and basic fucin, you get carbol fucin. So sometimes people think that it's carbon fucin or something. Carbon coming from carbolic acid. And then the fucin coming from the basic fucin. So it's the combination of the carbolic acid and the basic fucin that gives you the carbol fucin. Okay. So that's also an extra information for you. So remember I said that carbofucin, once you prepared it for your ZN staining, that is called strong carbofucin. I mean, once it's prepared, then you can dilute it. You can make a 1:20 dilution. 1:20 dilution means that 1 part of the carbofucin and 19 parts of water, because you are going to dilute it. So the 1 part can be 1 ml, and this one becomes 19 mils. That will give you 1:20. Or if you decide to make the 1 part to 10 mils, if the 1 part becomes 10 mils, then the 19 part becomes 190 mils. Okay, so you are going to get 200 mils. Okay, so whichever way, but if you make a 1:20 dilution, that 1:20 dilution can be used as a counter stain for your gram stain. You know, gram stain, you have other, other neutral red or saffronine as your counter stain. In the absence of any of them, if you are carbofucin, you can make a 1:20 dilution of carbofucin, and that can substitute for your counter stain in gram stain. That's also something you have to know. The same 1:20 dilution that you make that can be used as a counter stain in gram stain can also be used to stain sperms. Okay, very, very simple. So you prepare your you fix your slide as done already. Then sometimes you can also wash the smear with sodium bicarbonate formalin. That's the semen diluting fluid. And as we move to, you know, you haven't done the sperm count. Okay. Once you do the sperm count, that's where you're going to get the use of the bicarbonate formalin solution. Now you see that the bicarbonate formalin solution will also help to, you know, semen is usually viscous, okay? Some mucus like the bicarbonate will try to dilute or to break down all the mucus in it, so that it comes like more like watery, right? So if you are going to stain and you want it to, if you think that is too mucoid, then what you do is that you are going to wash the slide with the first slide. Though you're going to as if you are passing on ordinary water, but now you are going to we are going to use the diluting fluid, just some few drops on it, and then it is going to take away all the mucus, and will leave the sperm cells and all other cells in there. Okay, and then you are now going to apply your 1:20 dilution of carbofucin, and then you counter stain by covering with dilute methylene blue. Remember, the carbofucin itself is it's red, isn't it? And in not in microscopy, you always will need a counter stain. Okay. And so use metal blue as a counter stain, and then that's it. So you can also use alternatively, you can use the carbophysin also to do your morphology assessment. All right. So we'll continue tomorrow. And before, so let me quickly do this. I'm sorry for this. So after you have done your, you have finished your staining, whether by carbophysin or by using nigrosin or by leishman or whatever, then you are going to do your counting. Now, remember, I'm sure you know this. These days, everything is automated. So I don't know how you people, who has seen this instrument before? You know about this? The differential counter.
Yes, please.
Okay. Who hasn't seen some before? Okay. So if you have all seen some before, you have it's like the hematology auto analyzers. You know, you have some auto analyzer that will give you a 3-path, and then you have a 5-path. Okay. So the 5-path will give you all the other WBC differentials, and the 3-path will always give you either your neutrophils and mate cells, and then so forth and so on. So that is that. So with the differential counters, you have the 8-key differential counter and then a 5-key. All right. The 8-key has been designed in such a way that you can use it to also, apart from the neutrophils, eosinophils, lymphocytes, what are basophils, and then monocytes. If there are also immature cells, okay, you can now use each of the locks here or the keys here to represent something. I hope you are following me. Hello? Ladies and gentlemen, are you with me?
Yes, please.
Yes, please.
You are tired. If you are tired, let's stop it. So instead of this, if you want to use it for semen, then you can change the items here, because this one will show, okay, if you have a neutrophil, they will give you a sign that this will make this one neutrophil, this one is or lymphocyte, eosinophil, and so forth and so on. So you can now change all of them and say that, okay, the first key is for normal cells. Okay, the second key is for abnormal cells. And then you can have these ones also designated for the abnormalities. If you want to, is it a head abnormality or a neck abnormality or a tail abnormality, and so forth and so on. In that case, what it means is that, yeah, whether it's a head abnormality or neck or listen, it's still abnormal. And since this key is going to represent abnormality, it means that after these two, these ones have to be locked out, because if you click one here, two here, this is the total. This place gives you the total. So if you click here, you are clicking the neutrophils or something, it will register here as one. If you are clicking the neutrophils, eosinophils, it will click, it will also register as 2. If you are clicking here, it will also register here as 3. So what it means is that you have to give it to one of the mechanics to lock the second one. So to lock the third one. So the first one and second one, the normal and abnormal sperms will only register as the total. And then the other differentials will you only record them just at the end of the day to see that, okay, the abnormal ones, how many of them had head defect, how many of them had neck defect, and so forth, for your own interpretation. Okay. So this is something that you can do in your lab if you actually want to do it. And then if otherwise, some people will just do tallying. They have a paper and they will tally. If you have a normal, listen, you will just be telling us you are doing the frequency tables. But if you have a hematology differential counter, and now these days nobody, I'm sure a lot of people don't use them because you don't do the manual differential count. And so this equipment may be lying there in your labs. So you can now also make use of them for your semen report. Okay. Right. So this is just that. This is something to help you in assessing the sperm. You look at the sperm, you look at something in your slide, you look at it, you ask yourself, is it a sperm or not? If it's not a sperm, it means that it is not a sperm. If it's not a sperm, what is it? Is it a cell or something? Then you record it. If it's a cell, if it's a sperm, can it be classified? You see what it means is because to classify a sperm, it should have a head and a tail. Okay, so if it doesn't have a tail, a head, or it doesn't have a tail, then you can't say that it is a sperm. All right. So if you can classify it, then it means that you leave it. It is not a sperm, so you leave it. And then, but if you can classify it, means it has a head and tail. And then, is it large? Has it got a large cytoplasmic residue? If it has it, then what is it? You also register it. Then this is just like an algorithm or something, an order to help you to assess your cells. Okay, so and then once you are finished, we are going to calculate. We are going to calculate the percentages. To calculate percentages is always, like we said over and over again, we advise that you assess about 200 sperms, and then you count the number which is normal. So your morphology percentage is going to be the number of sperms which you deem to be normal over the total number of sperms multiplied by 100. All right, and so forth and so on. So the calculation too is also very simple. Now, what are the few challenges with the morphology assessment? Technical variability, different slide preparations and staining techniques can affect the clarity of the sperm morphology. You see, every lab has its own way of preparing the slide. Some people don't even prepare the smear at all. Okay, so it creates a problem. So if so these are the technical variability. That is because every lab is using its own different technique of preparing the slide. If you prepare different slides, you are going to get different results. Okay, and then the element of subjectivity. Even if you're doing the sperm analysis, I mean, somebody can look at a sperm and say it is normal. Somebody can look at it and say it is not normal. And therefore, that element of subjectivity is also a problem with the. And then you have inter and intra-observer variability. The same thing. Within the same lab, everybody will see a certain cell differently. Okay. And then laboratory variability. So the same way, one lab will classify a cell this way, another lab will also classify it another way. And these are all challenges. And even I mentioned earlier, inconsistent use of WHO guidelines. The same WHO guidelines for the 2021, it's putting the sperm morphology to be anything more than 4% is normal. Meanwhile, as of 1999 edition coming up to 2021, the lower limit was 40%. So if you have some data some years back and you want to review it now, the reference ranges have changed. And so that's going to give you a challenge with the classification. And of course, you know that morphologically, cells that are abnormal are called teratospermia. When you say they are abnormal, and then they are following one way, they are abnormal. You have like some abnormal neck, abnormal head, abnormal tail, all mixed up. Then that's teratospermia. But if all the heads are one way, if let's say all the heads are globospermia, I'm sure you know globospermia already. All the same, we say they are monomorphic. That's because monomorphic means that the morphology is one way. Okay. All right. So, and those are some of the technical that you can also learn. So I'm sure that when you get the slides, you can go through to and the overview that I've given you. I'm sure that you can understand. So that tomorrow we are going to also continue from the non-spermatozoa cells. Because sometimes within the microscopy, or as you do your morphology, you also come across certain things that are not sperms. How do you classify them? And that's our next topic for tomorrow. Thank you very much for your time, and sorry for the stretching you. I'm just trying to make sure that we try to complete the whole program this week. All right. Thank you. And if you have any question, let me know.
Hello, Grandpa.
Yes, sir.
Please, I want to find out. In the instance you have a low sperm count.
Yes, sir.
And you are supposed to assess the morphology of at least 200 spermatozoa, and you are not able to get the count up to 200. What do you do?
Great. That's a very great question. So two things that can be done. So the 300, like I've said, the more the number of cells that you count, the higher the accuracy. I hope that point is clear.
Yes,
hello.
Sir. Yes, Grandpa.
Now, so you can do a lower count. Once you do a lower count, it means that your possibility of error is higher anyway. But that is the second thing that you can do is that you can also pool the cell. By pooling the cell, what it means is that you are now going to take some sample and then spin. Okay, you take the sample and spin, and so you are going to get a concentrated sperms. I hope you are getting me, because once you spin semen, you can drop your harm. So you spin it that way, and then you take off much of the seminal plasma, so that you are getting concentrated sperms. All right, which can now be used to now prepare your smear. All right. So now you are pulling the sperms, and you are getting large numbers as much as. Now you are going to look at the sperms and their morphology. You are going to look at, so the more cells that you get, the more you can assess them. So the first question is that if it's low count, you can do low numbers. You can even do 50 cells. But if you do 50 cells, you still can do your percentage. It means that the number of abnormal ones divided by the 50 multiplied by 100 will give you your percentage morphology. Okay, that is, even you can even do 10, but you see that the lower the number, the higher your error. Okay, but if you want to be more accurate, and then you want to do with more cells, then you spin, and then you are going to now prepare. It's like if you have CSF, and then you are going to do your gram stain. CSF likely will have lower numbers of the organism, so you spin. So you use the deposit. Now prepare your smear before you do your gram stain. Yes. So once you have a lower sperm count, you can also spin, pull all the cells, and then now prepare your smear from that one. And then similarly, you see, that thing is in preparing your smear. If you have semen with also too much of sperms, you know, somebody can have over 200 sperms per mil. You know that. If you have too much, what you also have to do is that the aliquot, you see that we recommended that you take 10 microliters as your drop to prepare your smear. Now, if the sperms are also too much, you see that they overlap. If they overlap, the counting becomes compromised. Do you know that? Hello, who asked the question?
Yes, please. Yes, please.
If the cells are too much, it means that even if you prepare your smear, they are going to overlap. And once they overlap, it makes the counting very, very difficult, and then also the morphology assessment difficult. So in that case, what we also do is that instead of taking about 10 microliters to prepare, just take 5 microliters, just a small drop, so that you can prepare a smear that will also spread out for you to get your listing. So the question was very great. And I'm also extending it that if the cells are too much, what you can also do is to reduce the aliquot, the volume of the aliquot to prepare your smear. Similarly, if the cells are too low, you can also spin and then take the deposit to prepare your smear, and then off you go. I hope I've answered your question.
Yes, Grandpa. Thank you very much.
Okay. Thank you too. Yes, any other question? All right. Then see you tomorrow, and good night.
Good night.
Yeah, let's just say that. But let's see that.